I'm Dr. Philip E. Stieg. I am the professor and chairman of the Department of Neurological Surgery at Weill Cornell Medicine, New York Presbyterian Hospital, and director of the Weill Cornell Brain and Spine Center.
We're talking this morning how we can treat our brains better in 2017. A lot of us are worried, first of all, about dementia, getting Alzheimer's. Can we, first of all, do anything about that?
Oh, absolutely. There are things that we can do, and it's actually things that should start well before the risk factor for age, which is 65 years old. People that are young in their 30s, and if they have a family history for Alzheimer's disease, should be thinking about this and start leading brain-healthy lifestyles. Certainly, if you want to be diagnosed for a risk for the development of Alzheimer's disease, one can get a PET scan nowadays, and then there is also genetic testing for a gene called APOE4, and that would tell you whether you're at higher risk. And obviously, genes come in pairs. If you have one gene, you have a 20 to 30% chance of, or 2 to 3 times chance of increased risk for developing Alzheimer's. And if you have both genes with an APOE4, then you have an 8 to 12 time higher risk for developing Alzheimer's disease.
I know you have mentioned in the past that our brains are at risk from diabetes and vascular disorders and infections and things like that, and we can certainly do something about that.
Exactly. Diabetes and infections and stress are all components of our lifestyle that they're modifiable. Adult onset diabetes is a major healthcare problem, so that behavior can be changed. So what do we do? There are foods to avoid. You should avoid simple sugars and syrups, things that you buy on the counter that have high fructose. We want to avoid a lot of saturated fats, which can increase your low-density lipoproteins. You want to avoid trans fats, which fortunately industry now is helping us do. And then you want to avoid things like bleached flour, the white breads. You want to eat more whole wheat breads. In terms of thinking about how to protect yourself, I think that the simplest way for a person to go about this is focus on what everyone calls the Mediterranean diet. And what does that do? It's high in fish and low in red meats. And specifically, what the Mediterranean diet does is it's high in monounsaturated fatty acids, meaning it's high in olive oils. And by taking that on a regular basis, or by using it for your cooking instead of butters and lards, you can decrease your mortality by 8%. If you eat a lot of fruits, and the kind of fruits that you want are the dark and purple kinds of fruits, so you want blueberries and raspberries, that will decrease your risk of cerebral vascular disease by up to 10%. You want to eat lots of legumes, mushrooms, and nuts. That will potentially reduce your cancer risk by 4%. Finding good cereals has been the hardest thing for me. When you go to the counter, they all have sugars in them. So finding non-refined cereals and bread are exceedingly important. And then you want to reduce the amount of high-fat milk and dairy products. These will reduce, if you limit that intake, it'll reduce your risk for mild cognitive deficits and Alzheimer's disease by up to 40%.
That's amazing. That's amazing.
The good thing for you is that red wine is good, but not in excessive consumption. So basically you want to have 2 good glasses of red wine per day. And as I said, reduce the amount of red meat and eat more fish. And the kinds of fish that you want are salmon, herring, and tuna. Those will reduce your risk for stroke by up to 30% and actually helps with depression by reducing the risk by 30%.
What about becoming a vegetarian or a vegan, or at least leaning in that direction? Is there any real scientific basis as a physician to go with that route?
There are innumerable publications trying to justify the use of vegan diets. Really, the data is still relatively weak. I think common sense has to prevail. Yeah. So what are the things that I said that you should avoid? You should avoid a lot of red meat, a lot of fats, a lot of milk, a lot of butter, and obviously the vegan and vegetarian diets will do that for you. Yep. Personally, every time I've tried to do that, I need a piece of meat. I like chicken, and so a little bit of moderation, I think, is reasonable. If you have the discipline to do a vegan diet, as long as you have other substitutes for proteins, eating a lot of beans and things like that, it'll be okay.
How important is sleep for our brains?
It's very important in that they've determined that the best amount of sleep should be around the 7-hour window. And in getting an adequate amount of sleep, particularly getting REM sleep, it cuts down on inflammation in the central nervous system. You can't emphasize enough that a person should get plenty of sleep. In addition to that, by sleeping, you're reducing the external factors such as stress and other bad behaviors that you can have.
When it comes to exercise, is there a best exercise for our brains, or is any movement good?
The important factor is the duration. People that do the best get 30 minutes of exercise in a day. And I think that from a brain health standpoint, any kind of exercise is good, but then one has to separate out what are physiologically the good things to do. So as we age, going out and running marathons and doing excessive weightlifting and pounding kinds of exercises are not good. Obviously, kickboxing and boxing can increase the risk for head trauma, so we wouldn't recommend that. If an individual can get out and do a power walk, now just sort of lumbering along a street for 30 minutes, it's beneficial, but it's not as beneficial as getting out and doing a good power walk, trying to get your heart rate up a little bit into the 120s is what's needed. The impact kind of sports are just harder on your spine and harder on your joints as we age.
What I've been getting into lately, Doctor, as I get up there in age, is stretching and flexibility type of exercises. And I found that really helps me not only feel better, but I don't know, I'm more vigorous, I feel.
I would totally agree that stretching is good for you as long as one doesn't push themselves beyond the limit so that they have incredible joint pain from the stretching. The other benefit with exercise is it has hormonal impact. It increases the release of specific hormones and reduces your cortisol levels, as does sleep, which are kind of a stress hormone. And as you know, after you exercise, the endorphins kick in and you get kind of that runner's high. The other benefit from exercise, you need to be thinking about brain health and heart health as a hand in glove. What's good for the heart is good for the brain. The good news is we can replace your heart and we can open up the blood vessels. The bad news is we can't do that for your brain. So you really have to be aggressive about managing brain health. Again, it's reducing the sugars and increasing the exercise, reducing the fats. If you with exercise you reduce your insulin resistance, it cuts down on the inflammation in your body, and it induces the release of certain growth factors that are all beneficial for both heart health and brain health.
Does it really help to do things like crossword puzzles and brain teasers? They have these apps now on our phones that we can do them.
Yeah. Certainly, it doesn't hurt. The data on that is also a little bit questionable. We know that there are certain companies that advertise all these things. What we do know is that social interaction is important for maintaining cognitive ability. We know that having a sense of humor and reading are things that are important. stress reduction, things that are like mindfulness training is also quite important. So social interaction, and whether you achieve that by looking at a computer and interacting with people, all of those things that maintain brain function are good for you. Listening to music and going to musical concerts is also good for you.
Mm-hmm. Do you think that we will solve the riddle of Alzheimer's and dementia anytime soon?
Certainly hopeful. By soon, do you mean 5 years? Probably not. But I think in our lifetime, we are going to figure out the molecular constructs and how we can prevent the formation of the alpha-synucleins and also the tau particles that build up in an individual's brain. Or possibly we'll figure out how to genetically modify patients that are at high risk, those patients that have that APO4E deletion.
Well, you've been fabulous. Anything that you would like to say about this topic, brain health, before we conclude?
The key component that I'd like to say is I think that patients need to be proactive about their health. The unfortunate part about brain health is that once damage is done to the brain, the brain is repairable, but not to the degree that other organs in the body are. So it's really important that patients are proactive about maintaining their brain health. Approaching a healthy brain life will also have positive impact on your muscles, on your heart, on your kidneys, and your liver. So it's the benefit from a healthy brain life is multifactorial.